Hello and welcome to the program. I am Malik Jones and good to welcome you back to Star TV. Today my guest will be from the NGO Project Aid, which is highly focused on health, education, and some other areas that we will discuss about. And to talk about what Project Aid is all about, their relationship with their sponsors in Germany, and their intervention in COVID 19. I have with me here the project manager, Ibrahim Jubate. Ibrahim, welcome.
Thank you, Mr. Jones.
Also, the medical doctor with Project Aid, Eliezer Rodriguez. Welcome to the program.
Thank you very much.
Gentlemen, thank you very much. And let us begin by first trying to find out who Project Aid is.
Thank you, Mr. John, and good evening, viewers. Project Aid Gambia is an international NGO that was established in 1986, and it complements government effort in three areas. This is health, education, and agriculture. In 1991, Project Aid established a health center in Jahaly. And since then, up to now, the facility is running smoothly. And in 2004, they established a kindergarten. The kindergarten is also the first of its kind within that area because they have only lower basic and senior secondary, but there was no kindergarten within the Sierra region. So it is the first project that established a kindergarten in the area. And in 2003, they established a women garden in the community of Jahaly and Medina. This is area of agriculture. So you see both the three sectors of development are equally run by the project: education, health, and agriculture. Then in 2010, we have a plantation, moringa plantation, and in this moringa plantation, we have about 4 gardeners who are working hardly every day. And in 2012 also, we have a sister project called Peace Village that we have a linkage with, and taking children to Germany with elements that are not treatable in this country.
All right, we'll come to that later on. Elias, welcome to the Gambia. You're from Venezuela.
Yes.
And you're joining Project Aid here in the Gambia. When you come, what have you been doing?
I was working with another NGO before to be with Project 8. After I finished my contract with them because this COVID-19, so I joined Project 8 and I started to help them and develop also a project with face mask and support other clinics around the country, giving support with the COVID-19. So I'm helping them to establish like those kind of projects.
So you have visited, let me say, the projects in Jahaly and
I haven't been yet there.
Okay.
But I was working before in Sibanor.
Sibanor,
Yes.
in the health
In the health
area.
center, yes.
Now let's talk about the health in Sibanor, working with Gambians there. Let's look at that first.
Yeah, so I was working there with another NGO. It's called ECG, the Evangelical Church of the Gambia. I've been there for a month. So I was working as the medical director there. So I was giving some training to the local staff. I was also treating the local people as well because sometimes they cannot even afford the health in another health centers, or they cannot afford the medications, and sometimes they need minor surgeries, so it's not performed by anybody there. So I was trying to help them doing minor things to avoid them to come here to Banjul because some of those people don't have money to come here. So I will help in the
What are you specialized in as a doctor?
emergency medicine.
Emergency medicine. And what does that entail? What does that mean?
It's working in emergency rooms and major trauma.
Okay.
Yeah, basically that.
All right, Ibrahima, I mean, you're a manager for Project Aid, and of course, you have a holistic oversight of what the project is all about. Let us look at the clinic in Jahaly. What can you tell us about the project in Jahaly, and how are the people of the area reacting to such a service in that area?
Thank you very much, Mr. John. Jahaly Health Center is about 270 kilometers from the campus here, and the people within the area are definitely very impressed with the performance of the project, because basically I can tell you we have about 4 or 5 facilities within the area. We have Bansang there, that is about 30 kilometers from Jahaly, and Brikam about 5 kilometers, as well as Kudang. But believe me, about 99% of the population are coming to Jahaly every day. If you look at the statistics, maybe yearly, if Bansang as a major or hospital within the area is the referral point of all facilities within the area, is seeing 20,000 patients, Jahaly is seeing 25,000 patients. So definitely the people within the area definitely commend the project, they commended the project, and definitely always praising the project and always praying for longer life and good health for all staffs and supporters of the project.
Is it only an outpatient, or do you have inpatients?
We have both outpatient and inpatient.
All right.
Yeah.
Let's look at the capacity with the inpatient. How many patients can you keep in the facility?
In the facility, we have 2 wards: the pediatric ward, that is the children's ward, and the main ward. The main ward, we have a capacity of about 15 beds with 3 private rooms, and the children's ward has about 12 beds. Yeah. And during the rainy season, that is the malaria season, all these beds used to be filled to capacity. Sometimes we even have to organize floor beds due to overflow.
Why, that's the time when the mosquitoes get their festival?
Exactly. That's the peak, that's called the peak period.
Peak period.
Yeah.
For the mosquitoes.
For the mosquitoes.
And then you have a lot of people coming in.
Yeah, we have a lot of people, because sometimes basically we have about 360 to 400 patients in a day, which is a very huge amount.
Does it in any way intensify your staff there to work, and also you need more medicines and stuff like that? Tell us the logistics here.
Yeah, with regards to medicines, this is never a problem, because definitely the German sponsors are doing everything to have adequate medicine in possession all the time. And the capacity of staffs also is perfect. We have about 4 trained nurses on the ground and 9 or 10 untrained nurses with 2 laboratory personnel. So the capacity of staffs and equipment is definitely very conducive.
Let me take you, Dr. Rodriguez, to the present situation right now. Many people in the Gambia, I'm sure you see what is happening outside in the streets. It's not a matter of them telling you of what they think about COVID-19, but what kind of impression do you have when you move around the greater Banjul area, Serekunda, wherever?
Yeah, well, first of all, the quarantine is not happening here in the Gambia. So
lockdown, people are not locking down.
Yeah, exactly,
Okay.
exactly. So we have the lockdown, but to the contrary. So our borders are closed, so our airport is closed, but no people in their houses. So every market is open, everybody is out of their houses.
No social distancing.
No social distancing. Even in Serekunda market, you can see people gathering for more than hundreds. None of them are using or wearing face masks or washing their hands or taking some of the advices that should be done by this COVID-19. Also, so the commerces are open, the shops are open. It's like the quarantine or the lockdown right now are in the big restaurants or the big businesses as hotels or clubs, bars for tourists. So that's the only thing that is closed or the quarantine right now here in the Gambia.
Are you surprised?
I'm very surprised.
Are you afraid?
I'm not afraid. I'm not afraid right now. But yes, at the beginning, when I was looking everyone outside of their houses, no wearing face mask, no doing the distances to each other or the gathering. So I was very impressed and kind of afraid as well. Because, well, right now I'm also working here in a local clinic. So the reduce of the patients coming to the clinic have been like very low these days because people are afraid to go to the hospitals, but they are not afraid to go to the markets. So it's a strange situation, but yeah. So this is more of education to the people here in the Gambia.
All right, we will come to play some sound bite later on where you were producing the face mask and how people were going to it. But before I come to Ibrahima, do you think God is in the Gambia to
Yeah.
protect the people?
God is in the Gambia
God-
protecting
God-
all of us.
I am disturbed, and I said, well, maybe God has come and the angels are all come and spread their wings and they're protecting us because it's a nightmare out there. I'm disturbed by what I see on the streets of Banjul,
Absolutely.
and I kind of think that probably there's no virus here in the Gambia,
Yes.
because if there was one, I think by now half of the Gambia would have died.
Yeah, so I was actually afraid about that because
Yeah.
if the coronavirus touched the Gambia, that was my thinking before this.
Explosion.
So it was like, yeah, a disaster in the Gambia. But thanks God,
We
everything
believe-
is smooth right
Yes,
now. here.
maybe God has decided to come down and help the Gambians, because I'll tell you one thing: Gambians are very, very difficult people. They do not listen to people; they listen to what they want. I want to do this, I do it. Even if an angel comes down and tell them don't do it, they will do it.
Sure.
So this is a scenario we're all very, very much afraid. Ibrahima, let's look at what is the attitude of the people in Jahaly regarding COVID-19?
Yeah, the attitude of people in Jahaly definitely is just
The same like here.
no, not the same like here. Maybe outside it's the same like here, but when you come to the facility, it's totally different because we have a system in place. Our physical distancing is about 2 meters apart. Yeah, when patients come, because we have a waiting shed that accommodate about 200 patients, but now we are putting in only 16 maximum, and these 16, 5 will be sent inside the consultation. Then if they are seen by the nurses and from the pharmacy after leaving, then another 5 will go in. So we definitely maintain the 2 meters distance. Yeah, and everybody that enters the facility has to put on a mask. Yeah.
And the hand washing and stuff.
The hand
like that?
washing is also in place.
Okay.
Yeah.
You really ensure that these things are really.
Yeah. Every morning before we started anything, we just tell, I personally, that's my responsibility. I tell them that this is real. So let them not just take it as a joke. Some are saying it is a sickness in the combos because they've not seen anyone with COVID-19 within that area and they've never had a case. So it is said that it is combo sickness. But yet still, every day I'm doing my advocacy that it is real and these are the measures that we can use to prevent and protect ourselves and others.
I support when I hear you say that, because I have a friend also who's in the provinces. He's an old man though. Whenever I call him to say hello, how are you? How is that your sickness in Banjul?
Exactly. Yeah.
For him, it's not their problem. The virus, the pandemic, is not a problem of the rural area.
Sure.
It is a problem for the urban area.
urban area,
And I wish they
exactly.
came here and they see how people behave in what they alluded to was the sickness here. You have decided to try to come up with this idea of the face masks. What prompted you to do that? Was it because of the two clinics, Jahaly and Bounyadu?
Yeah, so Matthias, which is the owner of the NGO and the one that running the NGO also in Germany, he had the idea of this face mask. So also he provide everything for this taking place in Jahaly and to produce them. So he hired people for this and he bought all the materials. And so he started with the project about to make and distribute it or donate it free this face mask also to sell to some clinic to the cost price as well.
Okay, I think you have a list of the people, the beneficiaries of clinics that have been using that. Can we see who have been benefiting from these face masks?
Yes, all the facilities within CRR have benefited from these face masks. The community clinics were supplied each 250 face masks, and the health centers, the major health centers, are supplied each 500 face masks. And we have 9 health facilities, that is 9 major health centers, and 14 community facilities. And these facilities include Kauru, Kuntauru, Chamen, Same Karantaba, Janjambure, Bansang RCH, Brikamaba Health Center, Kudang and Tankungu. These are the 9 facilities that are supplied with 500 face masks. And the 14 community facilities include Balangar, Njao, Jelan, Bakadaji, Njoben, Firdaus, Jamali, Same Medina, Sare Sofi, St. Lazarus at Fulabantang, then Nana Community Health Center, Pinyai, Katamina, Barokunda, Kunting, and Nanaba. These are the 14 community facilities that were supplied with 250 masks.
And you gave it to them free?
Free of charge.
Okay.
Yeah.
Have you been able to monitor and find out that they are using these masks, and how do they go about in making sure that they can reuse this face mask, because you cannot use it once and throw it away? I mean, it's not enough.
Yeah, thank you very much, Mr. Jones, for that. That's the first point. In fact, when I get to the facilities, this is what I told them first. We are supplying these masks to you, but it is not enough. So we have to make best use of them and let us know that definitely COVID-19 is here with us. So it is not a single-use mask. So I tell them the procedure, because in Jahaly and Bounyadu, this is what we are doing. We are giving it to patients when they enter the facility, and when they are going home, we collect it from them. So after collection, we boil water, then soak them in the water, the boiled water, for the whole night with Omo or any other detergent, liquid soap. Then the next day, the cleaners will wash them and dry it under the sun. And this is what I'm explaining to each and every facility. And they definitely all concur that definitely they will maintain the policy so that it can last longer.
But you haven't gone to see them?
No, I just did a deliberation on Monday and Tuesday. Then Wednesday I traveled to the Combos. So hopefully, inshallah, I have all their contact numbers, and possibly we may even be tracking to see if they are putting them in place.
The masks are very, very important, but allow me to say it again and say it with a smile. You can count the number of people you put it on masks around here.
Around here, yes.
I think I only saw one person the whole day today. Just one person. That's the second one over there. Two people the entire day, from when I got up in the morning up to now. 2 people with face masks.
Same. Yeah, it's very alarming sometimes that when they are all together, even you can see people coughing or even sneezing on another person, and you get afraid about that. And people is like, they just don't care because they haven't heard or knew about any other new cases here in the Gambia. Even this week, even we have 2 new cases. But people are right now actually not taking that very seriously, mostly here in the Congo.
Why?
It's lack of education. It's mostly that. It's lack of education, lack of more, could be support of the let's say, health, in charge of the health in here in the Gambia. I'm not gonna say about the government or anybody, because it's like we all of us are responsible in that. So it's just giving more talks, giving more attention and focus in give more education to the people here in Combo mostly.
So you believe that the sensitization is not enough, or it's not reaching the target?
Yeah, exactly. It's not reaching the target, and yeah, and sometimes it's not taking place.
Okay, we go back to Project 8 and the facility, but this time round, let's go to Bounyadu.
Okay.
What do we have in Bounyadu?
Yeah, we have another clinic in Bounyadu as Jahaly. This was a clinic run by Riverboat International, but in 2017 we take the ownership. So it's a sister project. We are now working together. Yeah. Bounyadu also is at a very strategic location. This is between Kuntaya and Esau. Bounyadu is about 13 kilometers from Esau. Yeah. And though the patient flow is not so much there as Jahaly, but definitely there also they are trying, and we've supplied 1,000 marks to the facility, and the distancing also remains the same as Jahaly, 2 meters apart, and they are the same. We are doing the same thing. They are giving marks to patients when they enter the clinic and collecting it when they are leaving, and it will be soaked in boiled water, then wash and recycle for next day use.
Is Bounyadu the same like in Jahaly? You have inpatients and outpatients?
No, Bounyadu we have only outpatient.
Outpatients,
We have
okay.
only outpatients. There is no inpatient.
And how is the inflow of patients?
Yeah, the inflow of patients compared to Jahaly, I can say it's a ratio of 1:3. Jahaly has higher patients flow than Bounyadu. Yeah.
In terms of medical support?
In terms of medical support, it's equally to Jahaly. Yeah, because they are all supplied from the main office, so they are all having the same amount of medications or the same types of medications.
All right, I will come later on to the intervention of the Peace Village, which is a sister organization in Germany supporting Project Aid. But let me draw your attention also to Project Aid's intervention in the running of this kindergarten that you talked about earlier on.
Yeah, in 2004, Project Aid decided to establish a kindergarten at Jahaly, because it was seen that definitely kids within that area
We're not going to school.
were not going to school. They will just be loitering about, going to the rice field, some going to these madrasas, but most of them, maybe they started the madrasa 1-2 years, then they become a dropout. Then there the facility deem it necessary that we should at least have a basic for these kids. Then there they decided to establish the kindergarten, and since then, believe me, their target was at least 25 or 40 kids in a class. We have 6 classes, but each class now have more than 70 or 80. So we have to run double shift, a shift in the morning and a shift in the afternoon, because of the high flow of kids coming to the facility, the school.
So you only stop at the kindergarten level?
Yeah.
Okay.
Now, just at kindergarten.
And from
level.
the kindergarten, where do these kids go to?
Yeah, from the kindergarten, after their 3rd year, there is a basic cycle in Jahaly where they continue their education.
Okay, Rodriguez, Dr. Rodriguez, sorry, I'm calling you Rodriguez, Dr. Rodriguez. I'm sure you must see the rise of the coronavirus or the pandemic worldwide. It's becoming a nightmare, especially in the US. And what does it mean to the health institutions in the world? What are we seeing now?
Well, also this is big step in the world organization, in the health organization as well, because we have been noticing right now about the weakness in the entire health system in the entire world. So we are not enough doctors, we are not enough medical personnel around the world to manage a pandemic or to manage anything actually. So people, also doctors, have been quitting their jobs because they're burned out, because many hours, also lack of support, lack of medicines, lack of equipment on the health centers, on the hospitals as well. So they have been also involving seeing a lot of people dying. It's like we don't want our patients died. When your patients pass away because something like this, and you don't have the support, and you think that you are not doing nothing for them. It's also there is a lot of cases of depression right now with the doctors, within the nurses. So this has been a disaster around the world.
You're from Venezuela. What is the story like there?
In Venezuela.
What are you hearing?
Exactly. Well, everything that you can hear from Venezuela is 50-50. 50% is true, the 50% is also fake news. And so in Venezuela, there is right now around 4,000 cases. Thanks God, as long as I have seen on the news, is that there are no many cases of deaths. So they have been managing right now with this lack of almost everything in our country, in Venezuela. So because it's not a secret for anyone that Venezuela is passing through a very rough times right now with economics, politics, and everything. So the hospitals in Venezuela are disaster, let's say. But as I say, the only things that I know is from the news, and I have seen is like hasn't been that bad. Also, thanks God.
Okay, Mr. Jabate, again, your intervention in COVID-19 has taken your organization, Project Aid, to engage government for support in terms of getting equipment from Germany. What do you think? I am sure by now there are respirators that are lying in Germany, and all you need is for the government of the Gambia to appreciate what they're doing and give them a letter to say that, well, yes, this is for Project Aid, we want you to intervene. I think this is good. There's a stalemate here right now where Project Aid definitely wants the government or the ministry to facilitate that, but there seems to be some bottleneck. Are you making progress? Are you making headway in that?
Yeah, we are making progress, but very slowly. I could recall since 2018, we signed an MOU with the government that will be helping them with some hospital equipment. But these later have some captions where some questions were asked. So if everything is answered, then definitely it will be easy for the project. Because in fact it was proposed that we are to renovate about 35 health facilities nationwide. But believe me, since then up to now, some questions are still pending. They are not answered. Yeah.
Okay, we'll take a break. There's a slide I want us to see from Mr. Ba. Bob.
problem mo joni lotu mo darwa a lotu wata hawdi jon darwa a wadu mo ni abu mo ha ayani mo hondi ni
Welcome back to Talk to Malik Jones. I am here with Dr. Rodriguez, who is the medical doctor at Project Aid, and Ibrahim Jubate, the project manager. We now bring you this video, which has been the production of the face mask. And what do we have here?
So, this video footage shows the Project Aid Gambia has been handling patients at Jahaly Health Center. So, during this pandemic since April, so social distancing, washing hands, providing the mask. So this is what Mr. Jabarte was talking about, the providing hand washings in the health centers, the distribution of the face mask to every patient that comes to our clinic there. So also in this video, you also can see the production of this face mask also taking place in Jahaly. So as Mr. Jobarte was mentioning, so people are entrance to the health center and they are sitting right now in the kindergarten since we are closed right now because the coronavirus, so we are taking as the waiting area. Because it's like more space, so they can have the distancing, the 2 meter distancing in between them. So in this waiting area before they can be seen at the clinic right now.
Well, Mr. Jubate, because this is what is actually taking place in your facilities, and
Exactly.
People are absolutely complying.
Sure. Yeah, definitely. Since we started the issue of face masks and the wash handing, or since the commencement of COVID-19, patients and escorts are definitely with compliance with the rules and regulations of the facility, because we even have these in our rules that you either comply or you are not seen by a nurse. And thank God we did not encounter any difficulties. When patients comes in, we explain everything to them, they'll understand. From the washing station, then to the queue where they are seated at a 2 meter distance, then from there an amount of 15 or 16 is called for the waiting, for the OPD. Then from there, out of that 15, 5 also is sent to the consultation. You can see in the video that's the outpatient, the consultation room 1, then from there the laboratory. There is the laboratory. And from the laboratory also, their results are given to them, then they go back to the consultation. Then after the consultation, to the pharmacy, and finally leaving the marks outside. And that's the end of the day for that particular patient.
So what I wanted to ask Dr. Rodriguez, the patient upon arriving is tested. What's the procedure like?
Oh yeah, so they are not tested for COVID-19. So these are mostly with patients that are coming with fever, so they are tested for malaria, or depending the complaint is the test. But we are not testing for COVID-19.
Yeah.
You're not doing that
We are not allowed to do that
at Jahaly.
at Jahaly, yes.
Okay, but do you do the temperature?
Yes.
Yeah.
You when they come in, you do take their temperatures. All right, that is what I wanted to find out, because if they do not allow you, I don't know why they should not. Why they do it to me at an office? I go to an office and they say, Mr. Jones, wait, and then they put that on my forehead and they yes.
Yeah.
So that actually goes on. All right, all right.
So this is how they soak the marks in boiled water with liquid soup. Then it stays there overnight. Then the following day, it will be washed.
Now, who made these masks? They were made locally.
Yeah, they are made locally.
What kind of fabric?
Cotton.
It's made of 2 layers of cotton.
Two layers of cotton,
we are
yeah.
just following the WHO guidelines.
Guidelines. Okay, okay. And what does the WHO guidelines say? What does it say?
Yeah, so for the reusable face mask, so those are the guidelines. So also the guideline says about the washing of those face masks. So as Mr. Joba explained before, with boiled water, with soap, and leaving overnight and washing the day after again, dry it in directly to the sun.
So these people, when they come, it's only at your health center they use these things.
Yeah.
When they go home, they go normally.
Yeah, normally. And now what we did is we have also an amount, about 2,000 marks that are to be sold. So
To be sold?
Yeah, to be sold.
Okay.
So we
I
are-
hope that's not expensive.
Yeah, no, it's only $20.
$20.
Yeah, within the combos here, it's $30, and some are selling it at $35. But hence there is up countries, we are selling it at $20.
And that's for people who want to buy it
Who want to buy it?
and use it within their
Yeah,
environment.
anytime they feel like. You buy it at $20, you go home with it. It is yours.
Are people buying them?
Of course, people are buying them. People are buying them.
Why? Are they afraid?
Yeah, some
Do they want to take measures?
exactly.
to-
They are taking preventive measures,
Measures,
because
yes.
every now and then, or every morning when they seated before anything,
Yes.
I will be there telling them the dangers in COVID-19 and the measures we can use to protect and prevent ourselves. So this is why at the end of the day, before some of them goes home, they will come back to me. I want A, B, and C. Some will buy 2, 3. Yeah.
You know, I have a very strange picture which I see, and when I move around or when I sit, if somebody passes by with a face mask, they look at you as if you are from another planet.
Yeah.
You know.
Yeah. Yeah.
And it's not only that. Actually, people try to run away from you.
Yeah.
So
That-
I
that's
guess I guess they're thinking, or they are afraid, like if you are wearing the face mask, it's because you are sick.
yes.
So and they run away from you. They don't want to talk with you. They don't want to reach you.
So there is more to be done in terms of sensitization.
Exactly.
You know, I think
Exactly.
the sensitization has not reached the people of this country,
Yes.
or they don't just care.
Yes.
Yeah, Mr. Jones, with me, I think it's
They just don't
as
care.
you said. They just
Yeah, I mean, we just have to
don't
play-
care.
we just have to-
And since at the beginning of your conversation, you were saying that people just feel like doing what they think they can do. I will do this, even if
I
heaven
die.
will come down.
Yeah.
This is the bottom line. People don't care. Some think that this is just a story or just an imaginary word. but it is definitely not real. Some still don't believe in this COVID-19. This is the major problem we have in the country. Even within the Combos, I'm saying those in the provinces are saying Combo sickness, but those within here also. Yesterday I was at the market, Serekunda. It was just a nightmare.
You had your...
I had my max.
They were not, they were not running away from you.
The guy I even first greeted was telling me, hey, this is not existing here. So I was like, wow, what is happening? So may God help, but definitely.
Well, I think I do not want to be the devil's advocate and to say that this is why they don't care. Because people are saying, because we are journalists and we move around a lot and we listen to people when they talk, they only see one person to have said to have died of COVID-19. And even some people are even questioning the veracity of the cause of death of that person.
Yeah.
Some people don't believe that he died of COVID-19.
Exactly.
You see? So these are all myths that I think the Ministry of Health should have been able to address and make sure that they provide enough data to the people of this country so that they will believe in what is actually going on. I think this is where the problem lies. Your thoughts on that?
Yes, I'm actually very agree with that. I was thinking in those kind of things here before as well. Yes, also there is another topic here, or another part of the sensitizing here, because people here, they think or they say as well that they have to go out to find the bread, because if they don't go every day outside to work to find something, they will not eat, they will not bring food for their family. So that's why they cannot be quarantined but in their houses, they cannot be locked down at their houses, because if not, they will just die of hunger. So that's another part of it.
In other words, they must go out to go and find something to eat.
Something to eat, yeah.
Did you hear that as well?
Of course, this is the order of the day. Yeah, and it is in every corner of the country. Some are even saying, look, the government just want to disturb people. How can they just tell us to close all our shops when we are living from hand to mouth? This is not acceptable.
All right, we will come back to our closing statements on what we want to address in terms of the people of this country, their perception, how they see COVID-19, and how we expect them to react towards the pandemic. But let me just take a break and come to you on the issue of Gaba Cola. This is another health facility under Project 8.
Yeah, Gaba Cola was run by a German project. This one is not Project 8. But later, the project decided to phase out, reason to which best known to them. Then there in 2011, 2012, Project 8 see to it that definitely they should not let this facility go like that. So then there, they have to come in for renovation because the houses were all dilapidated and everything. So there was nothing that the villagers can do, as well as the government. So there the project manager, project chairman Matthias talked to the ministry that definitely we want to renovate this facility, and it was renovated. After the renovation, it was run by the project for almost 2 years, then later give it to the government back.
It was just a matter of just renovating.
Renovation, yeah.
But you have not put anything there in terms of hospital equipment,
of course,
drugs?
Because previously there was no laboratory. So a laboratory was established with about some solar panels, because at first they are not having any electricity supply, but it was electrified with 24/7 water and electricity supply with a laboratory, and it's a modern clinic. They built it to a modern clinic level.
And hand it over
back to the government.
Okay.
This was in 2014.
Rodriguez, we are running out of time, and we need to look at our last words that we can send to the people out there in terms of what is expected of them regarding COVID-19.
Yeah, well, right now, is to tell the people here in the Gambia that COVID-19 exists, and this is a reality around the world. It's a reality also here in the Gambia. Also, it's very important to the people knows that they can follow also some rules. So the face masks are very cheap and they are available in every pharmacy here in the Gambia. Thanks God we have available, because in some countries they don't even have anyone available in the pharmacy, so they cannot even buy any, so that's why they cannot even leave their houses to go to the supermarkets or nothing like this. Since also we understand that people have to go outside to find their food daily, so they can just wear the face mask every time that they are going to the markets, they are going to meet to other people, and also to encourage them to wash their hands, to use hand sanitizers, and prevention, just to take prevention measures.
Yeah, to throw a little light onto what he is saying, I think this is even the best time for everybody to go in for face masks, because the lockdown is now losing its strength. So definitely each and everyone has to go in for a face mask in order to prevent yourself and others.
Well, gentlemen, thank you very much for coming. Ibrahim Jubate, project manager for Project 8, thank you very much for joining me on the program. It's been a pleasure.
Thank you, Mr. Jones.
And also Dr. Elias Rodriguez, medical doctor with Project 8. Thank you very much for joining me on the program.
Thank you very much, Mr. Jones.
Well, those were the two people from Project 8. We were looking at the role of Project 8 here in the Gambia, and of course their intervention in COVID-19. We will be back some other time again to look at developments as they make their intervention in the Gambia, as Project 8 runs health centers, and of course they do a lot regarding the health of people in the rural areas, especially in Jahaly and in Bounyadu. For me, Malik Jones, we'll see you next time and have a good night. Bye-bye.
Thank you.
Good.